Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 4th, 2025. This video is on a consensus statement titled Rational and Methodological Approach Underlying the Development of the SOFA-2 score, that is the Sequential Organ Failure Assessment Score, published in JAMA Network Open on October 29th, 2025. What is the SOFA-2 score? It's a revised sequential organ failure assessment incorporating modern organ support and global feasibility criteria. Why was SOFA-2 developed? To reflect contemporary critical practices and improve outcomes over 30 years. What organ systems are included? The brain, lung, heart, liver, kidney, and hemostasis. How many points can each organ receive? Each organ is scored 0 to 4 based on dysfunction severity. What outcome is the score linked to? Predictive validity assessed against ICU mortality. What methodology guided development? Modified Delphi, systematic reviews and validation in 3.34 million patients. Are dynamic measures supported? Future research recommended on delta SOFA and max SOFA trajectories. Why exclude immune scoring? Lack of suitable routine biomarkers despite predictive value of counts. Why exclude GI scoring? Insufficient data and lack of predictive validity across datasets. How is sedation handled? Use last known Glasgow Coma Scale before sedation or score 0 if unknown. Can SOFA-2 replace prognostic scores? No. SOFA-2 describes dysfunction, not long-term weighted prognostication. What about use in low resource setting? Alternative variables and explicit guidance allow feasible global use. Which respiratory supports count as advanced? High flow nasal cannula, CPAP, BiPAP, non-invasive ventilation, invasive ventilation, and ECMO. How are vasopressors handled? Aggregated norepinephrine plus epinephrine dose thresholds plus others. Is renal replacement therapy included? Yes. Renal replacement therapy use or meeting renal replacement therapy criteria scores as 4. What is new in the CNS component? Delirium therapy included modified GCS thresholds. How are missing data and handled? Day 1 missing values scored 0, later missing carried forward. Is ECMO double counted? Respiratory ECMO scores respiratory. Cardiovascular ECMO scores both. How diverse were the data sets? Validation across 10 databases in 9 countries. What was the ultimate purpose? A standardized, simple, globally valid organ dysfunction score. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.